In DSM-5, we've made 3 major changes to autism from DSM-4. The first of these is a merging of the independent diagnoses of autistic disorder, Asperger disorder, and pervasive developmental disorder into a single spectrum disorder, autism spectrum disorder. Within that, we have eliminated childhood disintegrative disorder on the basis of it was not being used as a diagnosis, and more importantly, we've added a specifier age at onset, which allows a clinician to diagnose autism spectrum disorder with a later age at onset, typically after 3 years of age. The second major change in autism is the move from 3 criteria to 2, and this was done by combining the social and the communication criteria of DSM-4 into a single criterion, social communication or social reciprocity, which is the main feature of autistic spectrum disorder. Within autism spectrum disorder, the social communication deficits are impairing and lifelong persistent. The second criterion is restricted repetitive behaviors, and in that one, some patients actually, through training or developmental progress, may have less obvious manifestations of the RRBs during adolescence and adulthood, so that criterion can be met on the basis of history alone. The third major change to the autistic disorders I've already mentioned, and that's the inclusion of a number of specifiers. We expect clinicians to assign a primary diagnosis of autism spectrum disorder, but then to provide a very rich degree of information about that individual patient's onset and clinical course by the use of descriptors for age at onset, type of onset, were there skills lost or not, is intellectual impairment present, is verbal impairment present, as well as what kind of disorders are associated. As we know, autism spectrum disorder is frequently comorbid with intellectual disability, but it's also frequently comorbid with anxiety disorders, ADHD, and in the medical realm, epilepsy.